Cold, an apparently ordinary viral infection, carries unexpected health risks.
Chills, fever, headache, body aches, runny nose, cough, sore throat, and fatigue. These familiar symptoms could potentially conceal deeper harbingers of flu or COVID-19 infection or signs of more serious conditions such as sinusitis, otitis media, pneumonia, myocarditis, nephritis, meningitis, facial paralysis, and much more.
However, even before a pandemic breaks out, distinguishing between a cold, the flu, and COVID-19 is often challenging.
It is only when a mass infection occurs that health organizations gather evidence, analyze the severity, suddenness, and duration of symptoms, as well as the type and transmission of the virus, to determine whether it is the flu or a new type of viral infection. This process, however, takes time, which means that a large number of people are already infected by the time people notice the arrival of the flu or COVID-19. We must by no means underestimate the threat of colds. Cold symptoms often precede many serious illnesses, and it is entirely possible that failing to control a cold can lead to severe consequences. Therefore, we must take the prevention and control of colds very seriously.
The goal of this instructional video is to discuss how to recognize a cold in a timely manner and avoid serious consequences. Colds, flu, and COVID-19 are all virus-induced infections with similar symptoms and similar contagion risks. Let's first examine how conventional medicine treats these infections and why it is insufficient to master only the treatment methods of conventional medicine.
Currently, there is no specific cure for the common cold virus. Conventional medicine typically focuses on treating the symptoms of colds. 1. Rest and adequate hydration. Adequate rest and continuous fluid intake, especially drinking water with a high vitamin C content, help combat pathogens, strengthen the immune system, and eliminate waste products and toxins. This is an essential part of self-treating colds. Specific measures include getting enough rest to recover, avoiding spreading the infection to others, drinking plenty of water, and urinating frequently. 2. Pain and fever medications. This category includes drugs such as paracetamol, example, Tylenol, and ibuprofen, example, Advil, Nurofen. They help reduce headache, body aches, and fever. Paracetamol and ibuprofen belong to the group of nonsteroidal anti-inflammatory drugs, NSAIDs, but have different mechanisms of action. Paracetamol primarily acts as a pain reliever, analgesic, and fever reducer, antipyretic. It is believed to work on the central nervous system to inhibit pain signals and influence temperature regulation in the brain, leading to a reduction in body temperature. Paracetamol also acts on peripheral tissues to alleviate pain. Ibuprofen has pain-relieving, fever-reducing, and anti-inflammatory properties. Ibuprofen inhibits the production of prostaglandins, which promote inflammatory processes in the body. By reducing the production of prostaglandins, ibuprofen helps alleviate pain, inflammation, and fever.
However, fever is actually a defense mechanism of the body against diseases and helps boost the activity of the immune system. Therefore, it is often challenging to determine whether and when fever-reducing medications should be used.
3. Nasal sprays and nasal drops. For a congested nose, decongestant nasal sprays or drops containing ingredients like oxymetazoline or xylometazoline can provide temporary relief. However, it's important to use these only for a short duration to avoid a rebound effect. 4. Cough medications. For persistent, productive coughs, an expectorant like guaifenesin, example Mucinex, can be used to loosen mucus and facilitate coughing it up. For dry, irritating coughs, cough suppressants, antitussives, like dextromethorphan, example Robitussin DM, can be used. The choice of the right cough medication depends on the type of cough.
The use of cough medications also requires caution. Coughing helps remove mucus and foreign particles from the airways and keep the air passages clear. Using cough suppressants can suppress the cough reflex, leading to mucus buildup and worsening of symptoms. Therefore, it is often challenging during the treatment of colds to determine when cough medications should be used.
5. Antiviral medications. For the flu, antiviral medications such as oseltamivir, Tamiflu, may be recommended in certain cases. These medications aim to inhibit the replication of the influenza virus in the body. There are no specific antiviral medications available for the common cold.
While these measures can help alleviate symptoms, they cannot cure an underlying viral infection. Conventional medicine has three major wonders: antibiotics, hormones, and vaccines. In the case of viral infections, treatment with antibiotics is generally not necessary, as antibiotics are ineffective against viruses. Antibiotics may only be considered if a secondary bacterial infection occurs following a cold. The side effects of antibiotics are well known to people and will not be further discussed here.
Hormones, such as prednisolone, are not a routine choice for the treatment of viral infections. However, in some cases, hormones may be used to treat complications or severe conditions related to viral infections, such as complications in respiratory diseases. In cases of severe complications in certain respiratory diseases, such as asthma, bronchitis, hormones can be used to alleviate inflammatory responses and relieve symptoms. Overreaction of the immune system. Some viral infections can trigger an excessive immune response, as seen in severe acute respiratory syndrome, SARS, and in such cases, hormones may be used to suppress the immune response, reduce inflammation, and mitigate tissue damage.
The use of hormones comes with side effects such as immune suppression, an increased risk of infection, and osteoporosis. Now, let's revisit the issue of vaccine effectiveness. Why is it claimed that the effectiveness of vaccines is very limited? Question 1. When should the flu vaccination be administered?
The flu vaccination is typically recommended before the onset of the flu season because it takes a few weeks for immune protection to develop after vaccination. However, the question is, when is before the onset of the flu season? Often, we don't know exactly when the flu will arrive, making it challenging to control. Every year, there are different types of flu vaccines that must predict which flu virus strains could circulate in that year. The flu vaccine is developed based on the recommendations of the World Health Organization, WHO, and other health authorities.
Question 2. How does the WHO predict the potential flu virus strains for each year?
The World Health Organization, WHO, predicts the flu virus strains that are likely to be widespread in the upcoming flu season by monitoring global flu activities and the evolution of flu viruses. It collaborates with flu surveillance networks and laboratories worldwide to collect and analyze data on flu virus strains. Each year, the WHO convenes an expert panel called the Virus Evolution Working Group, which evaluates the currently circulating flu virus strains based on the collected data and analysis. This group then makes recommendations for the composition of the flu vaccine. As an example, for the 2018 to 2019 flu season, the WHO recommended the trivalent flu vaccine, which included the following virus strains. These virus strains were considered the predominant main strains of the flu at that time, so the flu vaccine composition provided protection against these strains. It's important to note that flu viruses are variable and change over time. Circulating flu virus strains, therefore, change over time as well. This is why the composition of the flu vaccine is updated each year based on current data and forecasts to provide the best possible protection against the currently circulating flu virus strains.
In other words, in different years, regions, and seasons, the flu vaccine should be different, and its protection against the viruses is also limited. Typically, a vaccine only includes protection against 3 to 4 virus strains. It's also important to note that the composition of the flu vaccine is based on predictions, and the accuracy of these predictions can be concerning. Predicting a new virus strain is, of course, not possible. It takes time for observations, data collection, and, most importantly, vaccine development. Question 3. How long does it typically take to develop a vaccine against a specific strain of the influenza virus?
The development of a vaccine against a specific strain of the influenza virus typically takes a considerable amount of time. Here is the general process for developing a flu vaccine. 1. Influenza virus surveillance. Influenza virus surveillance is an ongoing process aimed at tracking the spread and mutations of the virus. This includes the collection of virus samples and their genetic analysis. 2. Selection of influenza virus strain. Based on surveillance data and predictive models, researchers choose the virus strains that are likely to be most common in the upcoming flu season. These strains typically represent influenza viruses that are circulating in the region or globally. 3. Culturing and amplifying the virus strain. The selected influenza virus strain is cultured and amplified to provide a sufficient quantity of viruses for further study and production. 4. Vaccine virus strain preparation. The target virus strain is extracted from the amplified viruses and processed through a series of steps to prepare the virus strain for vaccine production. 5. Vaccine production. Using the prepared virus strain, vaccine manufacturers begin the production of the flu vaccine. This involves culturing the virus strain and preparing the vaccine formulation, typically through virus inactivation or recombinant virus technology. The entire process of developing a flu vaccine typically takes several months to 1 to 2 years.
Developing a vaccine is a meticulous process, but how quickly does the virus change? Unfortunately, it could happen in the blink of an eye. Every year, there are various variations of the virus, and vaccine development takes time. So, how can we ensure that the vaccine is synchronized with currently circulating virus strains? Ideally, administering the vaccine before the start of the flu season would be best. Here lies a contradiction. Theoretically, everything sounds correct, but in practice, it is challenging to achieve.
The flu vaccine provides protection for only a few months after vaccination, which means that the vaccine needs to be administered regularly. On the other hand, the vaccine can have serious side effects such as allergic shock, blood clot formation, myocarditis, etc., although the rate is very low and should not be ignored. Interrupting the source of infection and transmission routes, as well as strengthening the body's immunity, are undoubtedly effective measures in containing the flu and COVID-19.
Question 4. How can the source of infection and transmission routes be disrupted?
The regular and irregular culling of large numbers of poultry, ducks, geese, and other animals has been questioned by people and evaluated for its feasibility and negative impacts. Through the prolonged mass quarantine associated with COVID-19, people have come to realize that this approach is not actually a good solution.
Question 5. How can one strengthen the immune system? Is it true that people with weakened immune systems are the first to be infected by COVID-19?
When researching how to strengthen the immune system, popular science articles will tell you that maintaining a healthy diet, getting adequate sleep, reducing stress, engaging in physical activity, avoiding smoking and alcohol, and practicing good hygiene habits are important. However, this general advice is not really meaningful. Children and older individuals are typically considered groups with weaker immune systems. So, is it really children and older people who are the first or most affected by COVID-19? No, in the COVID-19 pandemic, some differences from traditional influenza have been observed, including the lower susceptibility of children and older individuals. When examining the relationship between IgG and IgA levels in the body and the COVID-19 infection rate, no correlation is found. Therefore, we should re-evaluate this question.
For these reasons, it is insufficient to assume that knowledge of modern medical treatment methods alone is enough.
There is a medical system that has a long history and extensive tradition in China and other Asian countries: traditional Chinese medicine, TCM. TCM fundamentally differs from Western medicine in its way of thinking, which, in turn, leads to fundamental differences in treatment approaches. This allows us to explore alternative approaches in TCM in certain areas where Western medicine may not offer satisfactory solutions.
What are the differences in thinking between TCM and modern medicine?
Let's consider an example. Imagine a vessel filled with water in which a microorganism is moving. If we do not know what type of microorganism, pathogen, is in the vessel, we do not know which insecticide, antibiotic or other medications to use. This is the thinking pattern of modern medicine. The cause of the disease must be identified first to find a treatment method. However, apart from chemical substances, there are many other ways to kill this microorganism. If we recognize that its survival depends on air and water, we can change its living conditions to eliminate it. For example, we could pour out the water from the vessel or cover it with a lid to cut off the air supply. Or we could even ignite a fire under the vessel to boil it. Even if we never know exactly what microorganism it is, we can still effectively deal with it. This is the thinking pattern of TCM, which considers the relationship between living beings and their environment. This means that conventional medicine and TCM have different approaches to treating the same problem. Therefore, TCM and conventional medicine can complement each other. Traditional Chinese medicine emphasizes the interaction between humans and nature. Factors like wind, cold, humidity, dryness, and fire exist not only in the natural environment but also within the human body. In other words, the natural environment forms a large setting, while inside the human body, individual small environments are created, defining a person's specific constitution. For example, if a person lacks sufficient yang qi, similar to insufficient sunshine, their body won't generate enough warmth, making them prone to feeling cold and susceptible to cold-related illnesses, especially in cold climates where they can easily catch a cold. On the other hand, if a person has an excess of yang qi but a deficiency of yin blood, they may be particularly susceptible to fever and sore throat when infected by a virus. In natural habitats, viruses and bacteria are ubiquitous. When the climatic conditions favor the growth of pathogens, epidemics can occur. The coronavirus was already discovered during the SARS epidemic in 2003 and mutates every year. So why did it break out at the end of 2019? This is because the climatic conditions at that time were conducive to the growth and proliferation of the new coronavirus.
Traditional Chinese medicine emphasizes the impact of individual differences on infections. Even individuals who are normally physically strong or have a robust immune system can become easily infected and may exhibit severe disease symptoms when their internal conditions align with the growth and proliferation of the virus.
During a flu outbreak, external climatic conditions in nature can be observed. As long as the environment within our body does not match the climatic conditions during the flu outbreak, the virus is unable to replicate adequately in our body. Even if we are infected with the virus, the illness does not become severe. The Yun Qi theory in traditional Chinese medicine provides detailed explanations in this regard. We can use Chinese herbal medicine to achieve this goal. Sanin Si Tianfang by Chen Wuzhe, a renowned Chinese physician from the Song dynasty, is a prescription based on the Yun Qi theory aimed at altering the internal environment of the human body to prevent infections.
During the COVID-19 pandemic, some Chinese doctors have utilized Chinese herbal medicine as a preventive measure, although this is not widely known or recognized by some individuals. In the following, I would like to introduce some simple, safe, and effective Chinese medical methods that are worth trying.
Due to colds, flu, and even COVID-19, they all have similar symptoms, so the following methods can be applied when similar symptoms occur, whether it's a cold, flu, or COVID-19. The key is to take action early. Try to control the symptoms within 3 days to avoid a worsening of the condition. Sweating to combat the cold. Aside from heat stroke, heat-related illness, most colds are initially caused by wind and cold. In English, a cold is referred to as cold or catch a cold, while in German, it is known as kalt or die Erkältung. This phenomenon seems to be similarly recognized in different populations. In traditional Chinese medicine, sweating is used as a method to expel cold energy from the body. Sweating is akin to opening the body's window to expel foes like cold energy and viruses through the sweat glands.
Here are 2 non-medical methods to combat the cold. Ginger spring onion red sugar soup. Please note that spring onion refers to the root portion.
Clean an appropriate amount of spring onions, slice ginger, and put them in a pot. Add red sugar and an appropriate amount of water, then bring it to a boil. Continue to cook for about 15 minutes. Finally, pour the soup into a cup and drink it in several portions while it's hot.
Warming the feet in warm water to induce sweating can actually help alleviate colds. The feet should be soaked in hot water at a temperature that is tolerable, probably around 38 to 45 degrees Celsius, for 30 to 45 minutes. The body should sweat lightly. Here are the precautions to be observed. Do not sweat excessively. Excessive sweating consumes too much energy and can be harmful. It has no effect if you do not sweat. If the water cools down, and you still aren't sweating, you should add more warm water. After the first time, you should feel better, but if you are still not completely well, you should repeat it the next day. After sweating, you have already lost a considerable amount of body fluids. You should drink vitamin-rich beverages with vitamin C. Sweating can help in the healing of colds. Can you also engage in physical exercise to induce sweating? I think it's better not to do so. It's better to rest instead of expending a lot of energy. Can you lie in a bathtub with warm water and induce sweating that way? In this case, you can't control how much you sweat, especially for older or physically weak individuals. If they stay in hot water for too long and then come out, they could collapse or feel faint. Therefore, I believe it's more sensible and safer to only immerse the feet in water. If you add a few drops of peppermint oil or include Sichuan pepper and mugwort, the effect will be even better. There is another method for dispelling colds: fire therapy. It improves circulation, alleviates pain, and enhances immune function. However, it requires expert application. Further details will be explained in another video.
The method of inducing sweating and dispelling cold is suitable for patients with a cold syndrome. Why is it necessary to distinguish between cold and heat syndromes? Because traditional Chinese medicine treatment methods state, heat is treated with cold, and cold is treated with heat. Appropriate therapies are applied depending on the specific situation to dispel cold or clear heat. But how can cold and heat syndromes be easily distinguished? In the case of a cold syndrome, the condition of nasal mucus should be observed first. If the nasal mucus is clear and watery, especially if it flows uncontrollably and is difficult to manage, it is a symptom of a cold syndrome. Additionally, back pain, due to cold contraction, and sensitivity to cold are distinct signs of a cold syndrome. In the case of a heat syndrome, attention should first be paid to whether there are symptoms of sore throat and dry mouth, followed by severe nasal congestion and reduced nasal discharge. Although individuals with a heat-sensitive constitution are more likely to develop a fever, body temperature cannot be used as a sensitive criterion for distinguishing between cold and heat syndromes. The presence of cough cannot be used for differentiation either, since patients with both cold and heat syndromes can have a fever and cough. The treatment of the heat syndrome is carried out using the heat clearing method. Sore throat is a major symptom of the heat syndrome. It's important to pay attention to diet when treating sore throats and avoid fried and spicy foods as well as grilled dishes.
Here is a dietary therapy for relieving sore throats. Honey radish juice. Peel and slice the radish and place it in honey. Let it sit for 20 minutes to allow a lot of juice to separate. Drink the juice slowly in several portions.
Shaoxiang bloodletting. There is a simple and effective method to quickly alleviate sore throats, which involves pricking the Shaoxiang point. Shaoxiang is the last acupuncture point of the lung meridian in traditional Chinese medicine and is located next to the thumbnail on the outer side. Use a sterile needle to quickly puncture and express a few drops of blood. The following two methods can also be used for heat clearing and require some skill and assistance from family members: cupping and gua sha on the back. I will provide detailed information about their application methods, indications, and precautions in another video. Stay tuned.
When we think about it more deeply, we understand why treating colds is so important. While a cold may seem like a minor illness on the surface, in reality, it can indicate serious health problems. When we treat a cold early and correctly, we can avoid many potential difficulties from the outset. Among the many treatment options, the intelligent use of Chinese herbal formulations is particularly noteworthy. From the past to the present, there are numerous historical records that, from various perspectives, describe the impressive effectiveness of Chinese herbal formulations in treating colds. These formulations are applied variably depending on the different symptoms of the cold. Classical works such as Shenghan Luan, Jing Kui Yao Lu, Wen Bing Tiao Bian, Qian Jin Feng, and others offer valuable insights by considering various disease states. Chinese herbal medicine is extremely diverse and profound in the treatment of colds. However, their methods cannot be extensively covered in this limited video. It could be an idea to save this topic for future opportunities and explore it in more detail.